So Thomas has quite long-standing symptoms, over 10 years now. So when he eats some food, he gets full very quickly and he gets stomach discomfort. And this can last for several hours after eating. And as you can imagine, this means that this affects his appetite and his enjoyment of food and can affect his quality of life. So we're really hoping that these tests will give us some insights in how we can help him. So we've done quite a few tests on Thomas over the years, and we found that his bowel doesn't really operate in a normal manner. So his stomach is variable in the way it empties, his small bowel is quite slow in how it transits food, and even his lower bowel, his colon, is quite slow. So it's quite a complex picture, but what we didn't really know was what the cause of that was, so how the nerves and the muscles interact. And we felt that Alimetry was a new test that could give us those novel insights and really help us to make some decisions on the best way to go forward. So Thomas's results were really quite interesting, and you want to break it down into two parts. First, the kind of gastric activity that developed after the meal. And what we saw with Thomas was straight after the meal, he got a normal increased food response. And normally that tends to fall away and come back down to baseline after an hour or two. But actually with Thomas, it remained quite high for quite a long time. It wasn't super high, so we know there's not a blockage there, but it was something not quite right in the way that the stomach switches on and then doesn't switch off as the meal empties. So the first set of results about activity showed us there was no significant blockage coming out of the stomach and that the nerves and the muscles were predominantly working quite well, just look a little delayed. The second important part of this was looking at symptoms, and this really tells us something about the sensitivity of Thomas's stomach. And certainly what we could see is that most of the symptoms that are important to him occurred during this period of increased activity related to the meal. And then as the activity came down a little bit, those symptoms tended to drift away. So what that means is that there may be a degree of hypersensitivity within Thomas's stomach, that a normal amount of activity causes him more symptoms than it would in other people. And that's important to know because there are treatments that can be used for that. So if we look at this normal response, what you can see is before the meal is eaten, then you have normal 3 cycle per minute activity. And once you eat the meal, this activity increases. You can see this by going brighter yellow. And after about an hour or two, this comes back down to baseline levels as the meal empties. And you can also see that during a meal, a normal person may get a few mild symptoms like mild heartburn or mild fullness, but these are very transient in nature. So if you look at Thomas's graph, you can once again see normal 3 cycle per minute activity here at baseline, and then a nice increase in that activity after the meal. You can see that by going a brighter yellow. But unlike in the healthy subject, that activity persists for up to 4 hours. And what you can see from the symptoms is that Thomas has more marked symptoms, especially related to the meal activity, and then these die away towards the end of the study. And this indicates a degree of hypersensitivity in Thomas that you don't see in healthy subjects.
In terms of comfort and tolerability, it was fine, and the equipment is not invasive, so there's the wiring that goes over the abdomen to record the signals, electronic signals of the gut. That's fine. Lasts a little while, so you have to sit there through the procedure, but that's okay. The meal itself, that may be uncomfortable for you depending on what your symptoms are, but no, in terms of it's non-invasive in any regards, that part was fine. The symptoms are after eating, I get upper right abdominal pain related to meals and bloating, and in order to control those, I have quite a strict diet. I eat smaller portions more regularly, and I avoid a number of different food groups in order to keep my symptoms at bay. Yes, it does. So, you know, after I eat, I often get some, after I eat certain food groups in particular, I get pain and bloating. So I guess there is a correlation. Mixed feelings really, because obviously you like to hear there's going to be a solution to the problems through surgery, but at the same time, I've had surgery before, invasive surgery, which hasn't helped. So I'm all of the opinion that any test that can help understand the problem better to help make more informed choices, I think is the more important thing here. Yes, I understand obviously treatments are evolving, and if there's something that's not invasive that could potentially help me, you know, that's low risk, of course I'd be willing to try that to help with my my symptoms. And it's a hard one to answer because everyone's condition and symptoms are very different. But a bit of advice I would give are persevere. And the journey's long, but over time your condition will evolve as well as how you manage it. So just persevere in that regard. Also, as time goes on, medicine evolves as well. But don't lose hope in that regard, and yeah, persevere on your journey medically. The other thing I would say is, at times it may require a bit of change in expectations of life in some areas to recalibrate in what you achieve satisfaction from. But ultimately, you know, listen to your body. Your body's telling you a lot of things, but be open from time to time to try new things where necessary as well, because it can be very easy to get stuck in the same cycle. But from time to time, you know, be bold and try something new. Yes, they have. If you think, quite commonly, gastric or abdominal tests are often like imaging, maybe structural or functional tests are often quite simplified. So having, you know, as treatments evolve, testing should also evolve. So something like Alimetry coming in to help understand problems in a bit more detail can only help with diagnoses. Moving forward, a more accurate diagnosis will lead to more accurate treatment. So, you know, for myself, it helped ascertain problems with more detail than was available before. I'm always very positive. Dr. Hobson's always very keen to not just look at the symptoms, but to understand problems holistically through all the diagnostic techniques that are available, which I think is important, because sometimes in medicine people like to just treat a symptom rather than, you know, properly understand what the problem is to begin with. And key to that at the clinic is a lot of the cutting edge technology that's available for testing. I will add that it's not always an exact science. So I had the Alimetry test a while back, and since then, as more data has become available, the results have been put into more context and can be analysed more accurately. What's important is the clinic is moving forward with new cutting edge diagnostic techniques, which can help, you know, improve diagnoses with the ultimate goal of improving treatment and patients' quality of life.
Alimetry has helped Thomas in a few ways. First of all, the next step for Thomas was to consider invasive interventional surgery. I think what we've shown with the results is that is not necessary at this point. There's no big blockage, the nerves and the muscles are still working quite well, but there is a slight delay and an increase in sensitivity. But we think that conservative therapy, whether that's looking at ways of getting the motility working a little better or reducing the sensitivity of the system, should be the next steps. So we've preserved the function that Thomas has, and we can try and improve that, and that should be our next port of call.